Forward. Order. Rated Chapter 107, the Act of 2022, Act relative to extending certain states of emergency accommodations and by the general court and signed into law by acting Governor Karen Polito, July 16, 2022. Revised Section 20, Chapter 20, the Acts of 2021, and so going to providing modification to the Massachusetts Open Meeting Law, which allows for flexibility to hold remote-only hybrid meetings while preserving public access and where appropriate public participation. Here's one project. Too hard. So
we're going to give a brief update on the alcohol regulations, I think. Moving Karen Sharon to panelists and also here. Lydia, you want to start?
Yes, I guess. So all of the changes that were outlined in the red line draft at the October Board of Health meeting, proposed to the select board and detailed in their packet, I believe, they were approved by the select board at their November 12th meeting, as written. So this includes the changes that the Board of Health provided written and verbal comments on, which were the extension of one this last call from 11 p.m. to midnight, and the decision to allow first-time compliance check penalties to be held in abeyance and to not require consecutively served multi-day compliance checks. My board commented on their appreciation in hearing from the Board of Health in your letter, open comment, public comment, and conversation between the chairs. The select board also discussed their reasoning for approving each of the changes that the Board of Health specifically mentioned. So regarding the extension of last call, the select board discussed aligning their policy with their current practice, and because 15 on-premise licensees are currently operating until midnight and 7 on-premise licensees closed earlier than midnight, they felt that their policy should align with practice. Regarding compliance check violations, the select board deferred to suggestions made by town council, which were summarized per ABCC compliance. Per the ABCC, compliance checks are meant to be educational, not punitive, and there were concerns or comments from town council that penalties may be excessive because the alcohol regulations contain a separate chart for penalties that includes anything in the regulations, anything in state law, anything essentially outside of compliance check failures. And one of those being qualifying concerns or penalties would be related to failure to scan IDs, which you mentioned in both sales minor violations. They happened in 12 out of 13 from 2023. I don't know. Do you have anything to add, Karen?
I mean, clearly we were hoping that they may have decided in the direction that the Board of Health's concerns were expressed. But I think given the fact that they conferred with town council about some of the aspects of the penalties, you know, I'm not sure that we would have been able to convince them otherwise, but I certainly welcome what the Board of Health thinks about the situation at this time.
They can hear us and hear our concerns and um, consider those things when, uh, especially if compliance checks things come up for them and they'll, option to put things in advance for a year, doesn't mean that they have to do that. But we'll be willing to work with them.
Every single hearing, they've never listened to us when we talk about alcohol. Just the compliance issues.
One of the other things I think they mentioned during compliance checks with other violations of I think it's fortunate.
And I don't care about the last volunteer that should never been that people with. Check on that. Yeah. Say essentially, I'm not seeing where this says it's a which I think it's just crazy.
Yeah, that was the opinion from town council.
Anything that also.
Yeah, I mean, and the big problem is that the compliance checks are the only way you really know whether establishments are providing alcohol. Because, if you're not doing a compliance check, any other time it happens, it's gonna pass through. So for every compliance check done, you're just continuing with so. I'll say that's complicated, but not really. Um, the Fair Health has broad power under Mass General Law, Chapter 111. However, state law expressly gives the ability to regulate. Some communities, like you can have charter delegated black and white. That's a very rare exception, almost always controlled by the ARC council or the select board. So variance was essentially not a good thing. The best way to select for policy and alcohol was advocate, testify to back up with everything. Yes. I think in watching the YouTube recordings, which are posted, and then you can get posted. I think the select board did respond. They didn't necessarily respond and make changes, but they did sort of, in their public comments, essentially felt that they had to respond to the Board of Health's concerns, which I think is positive. I would have preferred their response to be with revisions to the actual regulation, but I did influence the debate. I think they did influence the debate. Ultimately, it wasn't successful, but I don't think it was a wasted. I think there was value in doing it. Likely, we had been hoping to move to alcohol compliance checks 3 times a year or maybe 4 times a year. It seems like that's something that we could continue to push the select board to do.
Soon the alcohol trading.
For vendors. Yeah. So one of the ways that the select board did respond to feedback from the Board of Health was to take a specific, and Karen or Lydia might have to help me, but we basically said that there are some virtual options that are as good or better than some of the in-person options. So we gave them language saying you should be a little bit broader in what trainings you allow.
Right, but who's doing the trainings? Is that coming out of this department?
We do use the alcohol beverage service trainings. We've moved from tips to serve safe versions. That was maybe 2 years ago. But we offer them. Karen or Lydia, help me out. Was it 2 times a year or 3 times a year that we offer?
Yes.
Them?
Twice a year, and they're timed. They're paired often around the timing of the compliance checks.
Such that if a vendor fails,
Yes.
6 weeks later, there's a training you could send your staff to. So we
Yes.
try to do that cohesively.
That becomes the department. Now we're the select board, but they've created this mess.
I think that's a fair question. I personally like the fact that we are trying to encourage restaurants to do responsible beverage service. I think there's value there. The cost is relatively modest. Pay for refreshments, continental breakfast, coffee, and some sandwich for lunch type of thing, because people are there for a long period of time. I think it's one of the things that I appreciate about Needham, not just in terms of alcohol, but in terms of the work that Cy and Tara do with restaurants in terms of providing additional training for them. We are educators as much as regulators, and I think there's value to that.
Right.
I do hear what you're saying.
Yeah, I mean, in this case, though, we are not the regulators,
You're not.
right? So the point being, I agree. I mean, I want to be helping businesses in town, not hurting. But if the select board is just going to, continue to make this harder and harder, for alcohol control in town, then maybe they should be taking responsibility for the education as well. So I suggest.
Some happy news. We have 2 staffing updates to show the board or to tell the board about. We have I'll promoting to panelists. A regional environmental health agent that is working for the shared service district. He started his career with us at the MA conference, which is a lot of training in a very short period of time, especially for someone who has just started in public health that morning. But he was game to do that. I'm going to see like Jay, could I be promoted to the panelists and just say hello? We also Julie McCarthy, is our new assistant director of public health for National Institute for Health. That's filling the role that we vacated last winter, early spring. There are we do the best we can with that. So that I think we have good people for those roles. We have 2 positions we're still trying to fill: assistant manager for shared services, which closes today, and epidemiologist. excited that we have good people sort of in their positions, and we're looking forward to the open roles. Include the updated bios for all staff in the board's packet. You had been informed, I think, last month by Tara that we had added inspectors to help sort of with peak demand periods. One is in grad school, but has been very valuable for us in internship roles. Three of them are folks that have worked full time that currently work full time in other health departments. So we have a very talented crew that works with the Needham Public Health Commission. We're lucky.
Congratulations. Yeah, congrats. Yeah, everybody's had a very wide work and lived experience. Good.
Chair, we did advertise in the newspaper and on the town website. The hearing will start at 9:30. So if you wanted to start on the staff reports and then at 9:30 pause the staff reports and the hearing.
Staff report.
New staff, and we're very happy to find additional staff. They've been jumping right in, helping us with housing inspection and it's cool. Our part-time staff has been great, helping us with pool and food as well. That's one addition. But yes, our other pretty staff are getting trained up and get training for the well inspectors and to senior guys. So we're happy to have this extra system. We were able to accomplish our 3 annual bond with social wage. So this every month we have pretty good turnout, pretty good feedback as well. So this is why we do this work to help our establishments stay up to par with the new food code requirements. So they were appreciative of us giving them that overview. We uploaded all that information with Julie's help to our town website. So if any staff wasn't able to attend any of those trainings on our website. We are also gearing up to do those 2 ServSafe food manager training classes in January. And Lawrence Khan is going to be trained as a proctor to do the full day training. So we're having 2 full day trainings, one on January 6th and one on January 7th. The classes are about is there about 40 people?
Yeah, it's like 20 per class. So
It's a pretty good sign up. Great, because Pamela just did another classes in another town and they barely had 6 or 7 people. So we really got this information out, kept blasting it out to get a lot more people to sign up. So we're finding that helps. So that will take place in early January. So we're excited about that. We're also sent staff to do some trainings recently, some conferences, as well as MHOA. So we're able to keep our staff apprised of the latest updates on environmental topics, etc.
Yep. So the last topic we had written down was about Gyro and Bauhaus. We had them reopen after their local units were fixed, but we didn't have them prepare the Gyro product until they submitted SOPs to us that were in detail about how that would be processed and monitored. So they were able to give that to us. We gave them comments. There were some revisions made, and eventually it was approved, and then they were able to do that process again. So the next inspection was raised their risk level already, so they'll be having an inspection probably sooner than later, and we'll check in on them at that time. Outside of that, there's a couple of housing cases that I wanted to just bring up. One of them is on Linden Street. This is one that was condemned, I think last year or the year prior. And since then, the condemnation has been lifted because the occupant out and the unit has been cleaned up. And then at this point, I've done a re-inspection and there are no code violations remaining. So the unit has been reoccupied, so that place has been closed. The other case I wanted to bring up was the case on Riverside that has to do with mice. A lot more mice issues in town because of the winter time right now. But then at that time I noticed that there was a potential third unit in the basement. So we're trying to work with the town and town council on that to determine the next step and how to address that type of problem. So I just want to bring that up, so I might come before the board at a future meeting. So I just want to put that on your radar. We had some issues with the hotel pools in town. So we did a series of pool inspections on all 3 hotel pools that had closed due to just like the chemistry in the pools being completely haywire. So for the Sheraton had closed, I think they were closed for a couple of weeks, and we had them create an online log to track all of their daily chemistry logging systems, so we can also keep an eye on it. And then they have invested in putting in a monitoring system that will automatically check it for them, so they'll get like the general manager for the hotel can look on their phone and see what the readings are from the pool. So they're working on making it more streamlined, so that these issues don't need to occur. All 3 hotels have since reopened after a reinspection, after a past agreement. I mean, the pool, sorry. The hotel was not reopened. The last thing I want to bring up was about rats. I think last month we have 2 different ways of tracking I guess rats around town. One of them is complaints that come into our office. The other way is like we have set up for smart boxes and public lots in town, particularly around the center of town. And last month there were like 15 captures and smart boxes, and this month there was a drop to 1, 0, 1. I think it was just a blip, a random blip last month. Maybe due to weather changes, we don't really know. But this month we only had 1 capture, and this all amongst all the 4 smart boxes. And then we only had 3 rat complaints last month as well.
Jason.
We didn't know that building had it in the here 20 years ago. Yeah, so when we did our background, we got this time around, we did our background, and that came out, the building had. Yeah, I mean, we don't have any ongoing ones with building currently.
At the moment, we're working with the landlords and that trying to try to get access and to try to move it forward to address potential safety issues with that.
Oh, that's about Boston Children's. Did Buddha in there saying because of history of compliance with our office?
Yes.
Were they aware of that?
Yeah, we have let them know that. We had a long conversation, because I was been in touch with them as well, and we're still having conversations about them. We were saying there needs to be strict over history and what we have, and they're well aware of that, and so we've been working with them to plan get those SOPs that don't happen again.
Sounds like they didn't know that this
They did.
had a problem.
When that email came through and I saw that they were looking at something as a vendor, my red flag just went way up, and I said, sorry, this was an issue for a few years ago. That's what we got on it. These protocols submitted to us well in advance. You need to have them on the same page, with the. But it sounds like they've gotten better. Like since many years ago, I'm impressed with what they're showing us right now. They didn't have this before, so I think they've come up. They're well aware.
Their business model is somewhat unusual, where they cater in from other restaurants in the neighboring area for their cafe model, and then ultimately we'll have pop-ups as well, where they'll have like restaurants come in catering food. So it makes it very difficult for us to make sure there's compliance happening. That's what the issues were previously, was that they would have these pop-up events, and then we were on it. We were not set the the plan or application to us on time, and then would go there for inspection and different from what they had submitted to us. So we're hoping that it will this time around be addressed. We know that they have two other locations, one in Cambridge and one in Boston. So we're gonna reach out to them and make sure that see if they have any compliance issues in those cities, those locations or in those cities.
They bring all these other vendors in, what those vendor stickers on.
Right, so we asked for their menu item list in advance and what restaurants will be taking over for these potlucks. Like at least a month in advance, so we know, we can schedule out. Because this could be a nightmare if there was ever a foodborne illness, and we go there and it's a completely different restaurant, a completely different set of menu, and this is what happened before. And so we said, this cannot happen again, this has to be very streamlined, straightforward SOPs. We need to know who these restaurants, are on any given day. So we're gonna make sure that's all set up. It was Kendrick's, yeah, it was down there.
So when they do pop-ups, it's not necessarily from Needham.
It could be an
Establishments, could be outside.
Do those? Right then, or do
They usually bring the food and repeat the food, so
no understanding of what they're doing? That's where they do it.
Other help.
but food, like I said, we also had issues with management, like certified food manager, Kentucky from site. Food and now has that initiative that they all have a staff member that's certified on site. Now, and they'll be organizing it, they take the temperature when the food gets delivered and all that. They have that all set up in terms of some things and temperature logs, food manager will keep track of these, so that's much more organized. For food safety, before. We're hoping, that this will be a better round with them, but they know very well that we have these issues.
I mean.
Exactly.
That's what I'm surprised possible. Something that I get probably time for accreditation.
Yeah, Linda and Allison, excuse me, Linda and Allison aren't here. We're gearing up for our virtual site visit on November 8th. In-person site visit from the Public Health Planning Board on December 2nd. We're looking forward to it. Number one period of hard work. We're ready now. So ready?
Now in October, we had
We also have Rebecca, if you want to try to do traveling meals briefly before the hearings.
Probably could, yeah.
Are you all set with Board of Health or which sort of in-person meeting?
So Ed said he was available, Rob said he was available. If it's more than two, it has to be a publicly noticed meeting.
Yeah.
I hopefully, I'm pretty sure we'll go. We've got quite a lot for preparing, re-preparing. We had some consultants take us through a mock site visit where they drove us on sort of everything for hours. And we found some areas to improve from that. So I think we're well. I'm sending it. Don't confirm whether I think it's 11. I'll confirm. It's either 10 or 11. I think this year you want to do that. Rebecca, could you give a brief update?
So in October, we delivered 894 meals to 53 clients. We did see a little bit of an uptick in new clients, 7 new clients. 2 of them were previous clients, Springwell clients. They came back to the program. One was a new client that was referred to us from Community Council. And we did have one client that did cancel the program. She moved back home with her son or moved in with her son for additional care. I included flyers for the new Dementia Care Partner Support Program provided by the Community Council and flyers about the Thanksgiving Day sign-up meals from Needham Community Council, Needham Rotary Club, and Needham Golf Club. And that's about it. Any questions? So the audio's a little hard to hear, so I apologize if I can't hear anybody.
There, it is 9:30, so if you'd like to open, we have 3 hearings. We're opening simultaneously, yes. Hearing.
Three, regulation for public nuisances. Article. Body art establishments and practitioners. And then talking about rescinding Article 6 on offensive trades.
Should, here. We haven't received any public comments, although we did indicate clearly in both the packet and in previous board discussion that the board would not go take a vote this month, that it was going to have at least 2 months worth of public hearings and then vote either in December or in January. As the board can see from the packet, the easiest one is Article 6, which we're proposing to rescind in its entirety. There are some fairly extensive edits, mainly to add specificity and definitions, to update with other state regulations for the body art. And the control of nuisances, these are not quite as complicated as the body art, but has been revised as well. All right. Yep. The criteria are inside, please step in. The select board has in the town charter, or as part of the town charter, a bylaw for control of nuisances. So we, in part, want to retitle it to say public health nuisances. So there's a clearer distinction. We did obviously do some work on the definition section, and the finding section. They have a clear hearing procedures, but it's fairly straightforward. And we have, 3.5 with it.
So I had a few questions about this.
Yeah.
First, in general, just because the select board, the zoning board, when we get to start its regulation, is not mean that we should rescind something. As we have just seen with the alcohol, sometimes those other boards don't do what we think is best.
Yeah.
So I would not use that as a reason to get rid of something. Specific to Article 3, the fine structure, why did we change that? And I noticed that in section 3.5, 3.5, we said this is a criminal complaint, and assume it's a civil complaint, not a criminal complaint, and not putting people in jail, I hope. I'm utilized for $1,000 for each offense, which does not seem to be in concert with the fines that are listed elsewhere.
That's what I was saying, redundant actually, but the fines are up there. Yes, no, you can. Then it just says penalized up to 1,000, which would include all the amounts that were stated earlier, so it shouldn't see criminal.
Subsequent offenses, $300 fine, up to 1,000. What exactly does that mean? They're never going to be fined more than 1,000, or is it 1,000 per day? And when do we make, what are the subsequent days going to be? And do we have discretion on that?
Well,
It's not surface well all the time.
That's the only place where we say that each day on which a violation exists shall be deemed a separate offense. So
Correct. That's in 3.5. But if you look at 3.3, with a new 3.3, fourth and subsequent offenses, $300 fine up to $1,000.
Yeah, but that doesn't specify how we get there.
So it's exactly, how do you get from 300 to 1,000?
Is it the 10th violation that's 1,000, or is it the
That's
5th violation? Yeah. Okay, we need to clarify that. And there's maybe adding in up there that each day violation exists.
Talk about. So you're saying each day is a separate events. Does that be reasonable? When we saw like, some history, right? They weren't gonna clean that up in the day. Right? So all of a sudden, very quickly, those fines escalate. Now, I mean, obviously, we could waive that.
We should clarify, I think when by the violation, we give a period in which the work needs to be performed. So that, for example, you have 7 days to remedy the violation.
Mhm.
And my understanding, that we should clarify with town council is that essentially the violation is if it is not remedied on the 8th day. Okay. You have discretion in terms of how long you give them to comply, and oftentimes our NSI use their best judgment and say, right there, we're comfortable saying, okay, you have 3 more days to get it done.
Sure.
But we should clarify that, and I agree on specificity. Yes, so, and we will repost and resend before. And so the artists. 6. I didn't put 6. I think I did 376 because so. Yeah, Article 7 is a much longer regulation, and the revisions were quite a bit more substantial. As the board can see, there were quite a few clarifications for added specificity in the definitions section. Updated citations under state regulation. But the definition. There was incorporation of other state legislation, including people under 14 can, persons under 14 cannot get into piercing exception, ear piercing. Anyone who's above 14, but under 18 needs a parent permission. Yes, we want.
So you're in 77 standard practice, yeah, it's standard for province and those universities. But saying as set forth by the US CDC, I need to say this, okay, but CDC, specify as a particular date what that definition is. Okay. Given what they just did yesterday, that's in
Okay, that's a good one. Or state of Massachusetts.
if we have any state regs, I don't know. State right now is visibly removing all references to CDC from the website.
Yeah. Or right now, it sounds like we don't have body art establishments that provide full range, so we do have.
Oh, we have like cosmetic places that just do market lighting. That's it. Just one place, right? Like two park pictures.
There's right now, not any body art stuff, that is just sort of the.
Audits, we've generally said as a rule that, you know, funds that we levy are really. I see that, you know, this regulation would double the funds. What's the rationale for doing that?
Under 7.18.
Correct. The explanation was, you know, other towns are doing it, so we should do it too. It's like, wait a minute.
I mean, that's a fair question. We had some discussion about this. I'm trying to remember working last from. Does that have a common, sorry, go ahead. Sure.
Could it be related to when so body something? Inflation rate.
I first glance, I thought it'd be, we should have consistent sort of collective posture. Yes, if we. So I think we should do the 50, 200, 300. What does the board think specifically about the fine for a practitioner without a license? Shall we? Seems like a more egregious violation.
I agree.
I'm okay with that.
This raised doesn't make a lot of sense, right? Find the violation for any of these provisions, so are there? It's kind of a line at that respondents without lessons, but that's not what it says.
Yeah.
Right, so that really just needs to be reworked.
Door. We did as part of the work that the board had seen and we discussed last month. We did go through a process to look at modernizing the regulations in terms of including like updating citations to change state laws or state regulations. We also did a racial and health equity assessment. We have a policy and a framework that we included in the packet. But we did an equity workshop, and we didn't see that. So there are not comparable regulations from other municipalities. Similar provisions. It should be rescinded in its entirety. I agree that because someone else doesn't have it isn't necessarily a good reason to take it away.
Yeah, we felt that it hasn't been, no other community in the country has tobacco 21, but we did it.
Agree. We did feel that, that they haven't actually enforced it in a long time. There's been no violations of the regulation. I don't know. With our opinion, we did take it.
I mean, there's a lot of stuff here that's out of date, and some of it isn't, and I'd like to see kind of a crosswalk between this and whatever makes it this higher in the stage and below the line, so that we know we're kind of covering things. But some of this could be. crazy. They're rendering animal matters, so does that mean, you know, the butcher at Sudbury Farm has some trouble here? Yeah, what they do, okay, right. Probably doing that.
But some other things could come up, like the smoking of fish.
Yeah.
They're banking the baby on this in the backyard. We be allowed to do that just because we didn't have a rec fence.
Yeah.
Like is everything that we're taking away here, but we might be covered in different regulations.
Well, I guess I would say the making of egg dressing probably shouldn't have, shouldn't get there in the first place, maybe.
Right, and you know, smoking meat, I mean, to his point, you know. The backyard barbecue smoker, you know, I don't think we want to prohibit that necessarily.
Good point.
Well, is there anything that would want to?
I mean, but this is like, you know, trades or employment, so it's like, you know, if somebody wanted to put a smokehouse into town.
Yeah.
You know, is that something we want or not want? I don't know. But there are other things in this, you know, section 6.3, for instance. So that's covered by state law. But, that's why I thought we was. Some of it clearly is out of date, but not all of it.
Okay.
The plowing thing, I don't think that would apply to Volantes, but you know, goodness knows, you know, you spread some what is it, cockadoodle do or whatever, cockadoodle do. You know, on the garden, I have to plow that within 48 hours. I mean,
I'm not sure if it's a joke whether your land is in a condition to plow either. So,
exactly.
So I think a lot of this regulation could also be covered under the nuisance regulation. So nuisance regulation is pretty broad, so any type of offensive trades will produce a nuisance. I think that would.
So for example, I followed up on a nuisance complaint very vividly where a gentleman was putting rock horse manure in his yard. And the neighbor next to it was calling us, get over here, we enforce that in the nuisance. Right? So this is what.
Well, is that a public health nuisance now, or is it just a nuisance? Because if it's just odors now, it's not a public health
Wow.
issue.
We covered it in
Right.
public. Yeah, I agree.
Well, you know, that's again, you know, as we remove stuff, are you really gonna keep stuff under the select board? Maybe there's some things we should, but maybe not everything. I'm just saying, again, careful before we just involved.
put together either a crosswalk or a memo sort of outlining where we think their provisions are outdated or where provisions could be enforced under other regulations. And we'll bring it back. Yes. Yeah.
Regarding the strategies which is approved to not cover square teaching. Alternative to suspension program, how it's being implemented in each of our towns that implements it, if they need any support and if they're experiencing any challenges. In September, I met with the UNAP grade facilitator and in October, I used with assistant principal to work for me to facilitate the program in Rockport. Good. To have work on it and support them. And I also met with the newly hired K-12 wellness director for the town of Dedham Public Schools to discuss alternative to suspension programming there. Town in their cluster that doesn't use IDECIDE, but they're considering using that in place of what they are currently using. And I also discussed with the wellness director the two health curriculum programs that are in our strategic plan, alcohol education, Stanford Smart, Stanford Smart Talk, cannabis curriculum. And she expressed interest in both, particularly the cannabis program, and it's connecting health teachers in that with myself and the Dedham prevention staff. The goal of that strategy is not that I or other prevention staff in Dedham would facilitate the curriculum, but if it starts out that way and they see the value and sustain it themselves, I would consider that to us. And then regarding our parent and caregiver social marketing campaign strategy, the first of two focus groups was held in September. We spent October analyzing the data and preparing to hold a second focus group in November to test messaging and themes identified. We, in September, did not have any parents or caregivers from Westwood, but we were able to recruit one. So at the November meeting, all 4 towns were represented.
Good morning. I apologize, my voice is a little hoarse. So during the month of October, SPAN was very busy doing outreach in the community. We were tabling at several events, including the Harvest Fair, the Fall Family Day, and we also were at the Drug Take Back Day with the Needham Police, at which they collected 70 pounds on that day alone for the event, for a total of 474 pounds collected over the previous 6 months. And I will tell you that the average monthly collection of the medications that are turned in by the community has been creeping up steadily over the last 2 to 3 years. So it's, on the one hand, wonderful to see that increase, that people are cleaning out their medicine cabinets of medications that they really are no longer using and shouldn't be left there. But we also had our SPAN Fall meeting, which was styled as an open house to try to increase membership capacity. And we did get 3 new parents who attended the meeting, and we're hopeful by that we will see a little increase, if you will, in our SPAN membership, especially on the action teams. So we had 20 people who attended that meeting. From an advocacy and policy standpoint, Monica DeWinter and I have been participating in a new opportunity called the Alcohol Advocacy Collaborative, which is offered by the U.S. Alcohol Policy Alliance. It's a 8-month series of meetings that we attend to learn about creating alcohol policy. And we also are benefiting from one-on-one coaching sessions every month during that time. And it's also something that we've opened to all of our prevention staff, that they can come into any of these meetings along the 8-month program. So more to come on that. From a opioid settlement fund update, I'm pleased to say that we submitted our annual expenditure report ahead of schedule, and we just learned recently that that report has been approved. So that's good news. Angie McDonald has been very busy working to move the opioid settlement fund strategic plan forward bit by bit, following the goals and objectives of that strategic plan, and has been trying to put special focus on increasing the number of people in the community with lived and living experience who provide input to the work that's being done in Needham for the opioid settlement funds. To that extent, she's working on gathering their input through an advisory committee that will report updates to Tim. And we're also looking at options for providing transportation to the peers in the coaching program, the peer recovery coaching program. So more updates to be provided to you in the future. We helped the police in October to conduct an alcohol compliance check. Our role in that principally involves finding the 2 underage operatives who are the shoppers who go into all of the businesses in Needham to attempt to purchase alcohol. We had 1 sales to minor violation It was the Needham Golf Club. And in that case, the employee did not ask to see the operative's ID. A scanner was not used. And then finally, I just want to plug the fact that the salsa students have been amazingly busy. I saw a photo of one of their recent Friday general meetings. There were I think there were 75 students in the room who came to that meeting, which is held before school on Fridays once a month. So that's a real testament to the work that's being done. And then from an event standpoint, they brought the Red Ribbon Day prevention activity to the high school this October for the first time, which consisted of a really large vinyl banner that they put out during the cafeteria hours, and students were encouraged to sign that banner to pledge to be drug-free one step at a time. And while I don't have the exact number of people who signed that, I can tell you that there were, at least from a visual standpoint, probably about 100 students or more who signed that. So that's a very positive engagement with our high school students. Please let me know if you have any questions. And I did include on the back of my report the updated alcohol compliance summary that we track for responsible beverage service training and alcohol compliance checks.
So, starting.
I am having a little difficulty hearing the audio.
Following up.
I apologize. I'm not sure if you've asked me a question.
Okay, we'll follow up with Denise. I don't know if she
Okay.
has reached out to Karen, but we'll make sure we actively reach out to.
Okay.
Almost certainly, we'll represent.
Okay. That'll be good. Okay. Well,
That's you.
Yes, good morning. So for October, my focus was preparing for the accreditation site visit. So I reviewed the prepare for and response to emergencies documents. Also, I labeled the basement supplies and participated in the mock site visit as well. I did also continue other tasks, including participating at the NC8 crisis communication planning team and at the Region 4AB hazard vulnerability analysis workshop. But those were my second focus. So the main task for October was concentration at the accreditation preparation. And that was my main priority and will be for November as well. Thank you, and I am happy to answer any questions.
All right. We have a report from last respiratory virus season, dictated mostly comparison. So the DPH sort of just started to make vaccination data available again, and they've got some new data that I wanted to include in this that I thought might be interesting. But sort of first off the bat is we're definitely seeing lower vaccination rates this season than we have previously, which I don't know, it doesn't shock me necessarily, but I pulled up from February this year, so not quite a comparison because it's more end of season. Our influenza vaccine rate in Needham had been 60%. Right now it's sitting at 39%. And our COVID vaccine rate has been 37%, currently sitting at 13%. There is still much time left in the respiratory virus season, though I do think people tend to try to get it before the holidays, anecdotally. So be interested to see sort of how that plays out. And that's the case for sort of all age groups we're finding are pretty much below where we were for last season. For example, like our influenza vaccination rate for our 80 plus population was 79%, and it's 57%. So I do think that that's again concerning. I don't know how much of that is the overall culture we have right now. But I hope that people in the next couple of months will run out to get their vaccines. I did put RSV data in there again. That's cumulative data because you don't you get it once and then you're all set. It looks like our RSV rates had sort of dropped from last year. Looking at the data, we were at some slightly higher numbers. I'm realizing the qualification changed. So it used to be ages 60 to 74 qualified if you're at increased risk, and now that's 50 to 74. So that did sort of change our percent of sort of eligible people. I wanted to just kind of highlight some of the data that the state is now showing in their vaccination dashboards for RSV. Just kind of being able to track see and also sort of this new graphic of showing infants that are immunized against RSV and the proportion of them that are getting it via the maternal vaccine while the mom is pregnant with the baby, or those getting the monoclonal antibody. And it looks like there is a real preference for the monoclonal antibody for infant protection. We're good to see people are getting that either. Emergency department visits are still considered very low in Massachusetts for respiratory virus illnesses. I'm sure that tends to take a turn as the holidays approach. But wastewater is currently saying the same thing. What other updates? Biosafety committee. Let's see. We did meet earlier this week as a biosafety committee, really partly just to do a check-in occasionally, and partly to look at our regulation and make sure that the practice that we've been going through the last couple of permit cycles is matching what we have in the regulation. We didn't want to add anything or modify. There were a few sort of small changes that we considered making, that those changes will continue being made, and then we'll bring that to the Board of Health for your review and for a public hearing. And then you need to.
Yes, Rob pointed out I'm very bad at monitoring the clock. Mr. Chair, it is after 10.
Right.
If you would consider holding open the hearing and you give that public comment, the board should resume the hearing at its December meeting.
Okay, let's do that. And then that part here, I think it's not really wage.
I had that marked in my head too, and then I just kept yapping. So my last update is that we're getting very close to finishing a draft of a community health survey, which is far too long and needs to be parsed down, but I felt like it was better for us to get lofty and trim. We can only ask people so many questions, but they will give up on our survey. So there will be some questions of like, in what order do you capture? You ask questions to make sure people answer them. What's the information we really want to get from people before they might give up on a survey? We're going to be holding 2 community engagement sessions in beginning or middle of December, I think 10th and 11th. And so I'd love to then kind of summarize that feedback and bring it back to you with sort of this draft survey with some sort of specific questions for you. So hopefully in the next meeting. That's me.
Part of that's to address the board and the public health professionals. That we have Beth West now left health survey data. We have some senior survey data. We have very little.
We do.
I'm gonna let's pass some of that off to Ginny, because I do think that we've had actually a lot of good success in that, in our vaccination clinics here.
But if you have any more questions for Joy,
Next anyway.
Yeah. And
I'm just wondering what.
It's
always
what-
had it
where
organized.
to Get that number uploaded.
Possible that there's people that are getting vaccinated that we're not capturing in the data set.
Yeah, if people are getting vaccinated out of state,
Out of state.
we could be missing them.
Like CVS and Walgreens, all that goes to the database.
Yes,
And,
most people enable it. I don't, there might be some holdouts who say, no, I would not like my data sent to the state, but I think for the most part, people like to have their vaccine printed. So I think we could be missing people, probably not a lot of people.
And then people that get, I mean, a lot of doctors' offices don't include vaccines.
Yeah,
So they.
Yeah.
well, I know it's gonna go a little backwards from what Lori said as far as things are done, because we already surpassed our vaccination rate from last year. So our total vaccination rate last year was 533 or 735. October alone, we had 492 groups. And I have 5 orders, just one. So we've run clinics from September up until this Tuesday. At CAP, then we're going to go ahead and at the police and fire and the housing authorities, like we've gone everywhere, like all the per diems have done at least one clinic and worked out really well, I think. I think the other thing that I'm finding with the police is that we have been very aggressive with our advertising. Like I go to News You Need Them. I also do as a news Facebook group that reaches 16,000 people. It also goes on social media, and I have Amy put it in like every week. So I think that's where it's coming from and word of mouth. CAP. I've also added in there because we've gotten an uptick in where people wanting to do home visits. The COVID and flu. Delivery system, whatever you want to call it, where they went to their home and get the vaccines in their home. So more people have called and said, I saw you and that you have already done it and we thought, so I've done a handful of those. So that's what we've been able to do for people.
Do you, on social or Facebook or whatever, do you have that we are much lower than that's way like trying to get
And I've done, well, this in September, I did like like an active visits and like this many people inside CAP, and this was the age group, and 57% identified out, like I did that. I do that, and I'm honest to say, if you still need a vaccine, please call us, and we're being great, and I really proud of our numbers for this year.
That's interesting. Us, which only means that many fewer are getting it from Parkinson's. Why the switch? Why?
It was very surprising to me to see this because our clinics were going so well this year.
Ask the state, get the state to double check that data to say, hey, wait a minute, based on what we hear, this isn't making sense unless the.
Yes, yeah, I can ask someone in the immunization
They
division.
may say this is what it is, we're tracking everything correctly, yeah, there's been a drop in the pharmacies.
Yeah,
Sure.
yep.
do they segment it by where vaccines do they say pharmacy versus office practice versus
You would have to go into the MIS on the individual. No.
So
Yeah, you basically have to open up a person and then read it.
but it's by individual.
Yeah.
The reporting functions are not super. They're not.
No, it was a good idea.
Yeah.
It would be wonderful if it should tell people. I think Willie and I a couple of years ago tried to look at like our childhood vaccine. Like these don't seem accurate now. It's just.
eventually ask the state about it. Sure, it won't happen anytime soon, but maybe having that functionality.
I think getting some of the big group as a guest is having a possible amplify this message as well. Because these low vaccination rates mean they're gonna see a lot more respiratory illness.
I'm on the next meetings, and I think they have said that they're being pretty aggressive. Last year was like, I'll get it when I get it. If there haven't been gotten take as much as other years, I mean, I don't know, but yeah, I haven't asked for it.
I hear this year. I don't know. I think it's not a good action. Is what I'm doing. But it's still, better than not having. With that. Spots to have
Like, I was like, I'm just gonna try to meet people where they're at, just, at one point for like the housing authority, I tapped on when our per diem was doing a blood pressure, but I'm like, blood pressure version, greater thoughts. So that kind of works, and then for number Glen, I went when police and fire were doing a CP, and I just tapped in. For Harvest Fair, we got a lot of people.
if we can get Uber food, then you've got a chance of getting Uber food. Okay, I think, the public messaging for COVID is all back.
Yeah.
But once they come in for the flu, we can offer them the COVID.
Because I would do have. Hearing it. So, and we get those from the state, so I think that's also been an
And it doesn't show it because this was for the month of October, but we did get the COVID vaccine and already vaccinated.
Oh yeah, I can't wait to get that. What?
For quite a long time. Vaccine doesn't jump ordering batches. We sign a contract with them quite $100.
I could just stop there and I'd stop. I'm sorry. I don't have any other questions on my report.
Well, then, we get a number of people that vaccinated 10 times, but we'll share services efforts and so on.
Dude. I know we do some referrals like in the field and there were short work with people over. They don't have it on you. Some of our regular things that we see, I just see them every year. They come from our. Or anyone.
Because that might explain why we're doing something more vaccination for the percent.
But these are pieces. Not every year.
So that's mostly.
Remember the details on the ordering process, the other things. So that's really, that's something that I can bring to the AMA and say, physicians are having trouble. They don't see it as priority. That's.
I think poor Don has heard me ramble on about this, but I'm more than happy to write something that Tim can then review and pass on to you.
I think it's a source of frustration. There was obviously some questions and concerns about federal guidance and insurance coverage for COVID. And get us the specifics, but I think we originally tried to place the order in early October.
Yep.
And about it.
And the first week of November. Spoil.
See a lot more sense to be able to see this because, yeah, the real play here has nothing to do with our district. Other than it is that the vaccine manufacturers are going to stop manufacturing because the liability would be too great. Now that CDC has said this, that vaccine insurance fund is going to be decimated. But once that's gone, there's no protection. Vaccine manufacturers no less than working.
Foolish to hope for congressional intervention, but it seems like
Yes.
there will move to public health. I think I see Pat on live. I mean, I can tackle it. Kerry recently returned from that's great. As I mentioned, we did hire Jay Uzmanoff. He saw from the packet in environmental work. Okay. Happy to have them, and Jay sort of jumped right into training for local public health to start getting those certifications and getting eligible for doing the prerequisites for some of the in-person classes that will help you get certifications. Are working to schedule another shared service district meeting because we did sort of take a month and a half hiatus. We are still looking for a replacement for the assistant manager of shared services, and we are working to make sure that we spend out the grant funds responsibly. Massachusetts Public Health Alliance and the Coalition for Local Public Health put on a day for local public health to urge the state legislature to continue to support local public health through state funding lines. But means these two programs, the training public health excellence shared service programs. I think that did number the staff meeting.
Other items.
Bring down those regulations. Providing the board with a quite long budget packet with our capital fleet and operating budget submissions. We had our initial hearing with the town manager. I think one of the questions is how does the town meeting specifically feel about our applications? Right now the cost is relatively modest. The estimated cost is relatively modest, but we're hoping that town meeting will continue to support that. Obviously, consideration of Paul and some of the other projects. The ask is relatively modest. Then we've already appropriated $355,000 project staff the total all-in request will be 50.18, including that almost 400,000. But I think that will be something that the board and the council meeting will have to advocate for. Not only the traveling meals program for this board, but also the expanded opportunities for physical fitness for seniors. Also a big deal. The town manager and I are treating the capital request as separate from the operating. So if we have a brand new kitchen, I would then love to talk about an operational investment to staff it and produce meals. And there's a couple different models we're looking at. one doesn't preclude or one doesn't guarantee the other. If the renovation of the senior center is funded, that doesn't guarantee that we will immediately get staffing. Could happen right away. It could happen after a couple of years, phased in over time. So I think that's one thing that's sort of on my mind is we got to win this battle, and then we got to make the case for continued operational funding.
The crisis with that. If our provider says, okay, as of 6 months from now, we're out, finished, done.
Yes, that's possible. I think the recent coverage of the challenges with changing federal guidance on food stamps, changing funding or not stamps. There's been some local media coverage of much heightened demand at the food pantry that the community council runs. I think it's a little bit of the tip of the iceberg, and I think my sort of primary concern in that vein is seniors living on fixed income that are maybe in a home that is bigger than they need but don't have options to downsize and are on a fixed income and property taxes keep going up. Prices are still very high. Are we getting, are those seniors food insecure? I do know that every time we have a nice lunch at CAP, regardless of what we're talking about, there's a ton of people who come. So anytime we want to do a lunch and learn, if we say we're going to have, nice sandwiches from Bagels Best or somebody else, it guarantees 30 people in the room. So I would love experience, especially senior fixed income. We'll continue to advocate for that, but I will include the full budget request in the board. The date for finance committee hearings hasn't been set, but it's usually late January or February. Sometimes it leads into one of the things that we are going to do very clearly is in the ask to town meeting, which is also sort of asked to finance committee and then asked to the town manager for the use of opioid funds. We're going to try to stress very clearly that we're looking to use funds for sort of anything that was within the strategic plan, rather than use it for salary and training, and then have concern if we want to use it for mileage. And so we didn't say we use it for mileage. Well, how are we going to get to training? Of course, we were going to use it for mileage. So I think we're trying to make the case in our ESR 5 warrant article this year that as long as we're sort of public engagement and community input were what helped develop our strategic plan. And as long as we're working within one of the allocated program areas that the opioid settlement funds define, and as long as we're following our strategic plan, which was developed with community input, sort of want to say that kind of everything under the sun within that framework is fair game. Whereas in the past, we've been much more explicit, this much for salary, this much for supplies, this much.
Now adjourned at 10:25. Thank you. You all for good news.